Hi, it's Mayor Stahl. Welcome to another edition of Business Spotlight. I'm here at a longtime East Brunswick establishment, the Alternative Integrative Medical Services, here on Tice's Lane, 150 Tice's Lane. I'm joined by Dr. Picone and Dr. Reisert. Gentlemen, thanks for having me here and all the residents here of East Brunswick. Doctor, first, why don't you just mention what is AIMS?
Alternative Integrated Medical Services was started so that we could fill the gaps between traditional medicine and alternative care, speaking like chiropractic, physical therapy, nutrition, and branches like acupuncture as well.
So a very multiple discipline type approach.
Exactly, multiple disciplinary approach. We have 5 medical doctors here, 5 chiropractors, 2 physical therapists, an acupuncturist, and a nutritionist. And we do the type of treatment where patients come in and they have been failed by traditional allopathic medicine and they're looking for a different approach.
Why don't you describe a little bit more in detail what that approach would be like on a typical type patient?
Well, our name kind of spells it out. We're an alternative approach that integrates regular type of medical practices with the integration of a chiropractic, a nutritionist, and exercise. Acupuncture is also used to relieve pain and bring about symptoms. The majority of our patients are in a chronic situation where they have been to many doctors, many different facilities, and they're looking for a different approach, and we fill that gap as a team. A regular patient comes in, they may or may not have the testing or results of labs. If they don't, we prescribe them. Then the team gets together and actually looks at these tests and see what is needed for them. Not all patients that come to us are accepted. They need to have an approach where they're actually part of the solution, whereas they've got to change something in their life. Their lifestyle has to improve, especially from a diet and nutrition standpoint and an exercise standpoint. Some of our patients have actually been to an alternative approach. They've been to a nutritionist or a physical therapist or a chiropractor, and yet it hasn't seemed to work for them. By putting the team together and doing these simultaneously, the body's expression of health then can come out and they actually improve because they're all done naturally together.
So does one doctor serve as kind of like the team leader?
Well, Dr. Reisert or myself will do an internal consultation with the patient. When they first come in, we will determine and triage the patient, more or less, decide which doctors in the group the patient should see. Usually patients, we have a lot of chronic fatigue patients and fibromyalgia patients, a lot of chronic arthritis patients. Usually those patients do need the full medical approach and the chiropractic and the physical therapy approach. So they would get examined by all of the practitioners in the clinic in those particular disciplines, and then a treatment program would be outlined jointly through all the practitioners, and the patient would see multiple providers within the clinic. Many times we have to change, as Dr. Reisert said, their diets. Some people are eating foods that really create inflammation in their bodies, whether it be in the bowel or in the joints, and they need to be aware of this. We're also a full laboratory clinic here, so we draw the blood and we send it out to LabCorp Request, whatever, and we do stool cultures and things like that so the patients can really determine which foods are a problem or an enemy to their system.
So obviously it sounds like not only you great doctors and chiropractors and the whole team, you make it very easy for the patient to get the proper care here in all one spot.
That's exactly right, because a patient, like for instance behind me is a treadmill, and if a patient were traditionally in a typical physical therapy facility without medical doctors there, and the patient had chest pain while they were exercising, they would be off to the emergency room. Here they're only 30 feet away from an EKG and a medical doctor that could say, it's just muscular pain, keep exercising, or we need to do something about this. So yes, we do make it easy having everything under one roof.
Now, I know you talked earlier, doctor, about people with chronic diseases, but do you also treat our young children?
Well, one of our medical specialists, Dr. Spiesler, is a pediatrician by training. So we accept just about any age patient. Again, it's totally based on whether or not they fulfill the needs. We're not in an acute establishment. We're not taking place of an ER or something like that. Certainly the patients that we have want to have their children as well as their spouses to see whether or not an alternative approach from a holistic and wellness standpoint. So many of our patients, even though they're not sick, want a lifestyle that would improve them not only now but in the future.
That's That's great. Now, we were talking earlier before we actually started the taping. You've been in East Brunswick for how many years now?
I started the practice in East Brunswick in 1973, April 1st, 1973. So 38 years.
So obviously very successful. You guys know what you're doing here.
Yes. We do have an intravenous program, I should mention, that we have for patients here that have chronic heart disease, Lyme's disease patients, multiple sclerosis, cancer patients. We have a very, very excellent program that is extremely well developed for intravenous therapies. For oxidative therapies, we do hydrogen peroxide drips and things like this. So we're one of the few facilities in the state of New Jersey that actually provides this service, and it's extremely effective for patients that have already had open heart surgery, bypass grafts, and things like that. This actually works to clear out all the arteries in the body, not just the ones that go to the heart. Extremely successful and no risk.
That's great. Some of the basics, obviously, you're located here at 150 Tice's Lane. Why don't you just give us your phone number, your hours, best way for people to get in touch with you, and also what type of insurance you take.
Well, we're the number is 732-254-5553, and that we do have a website, which is AIMS, AIMS clinic.com, and it's very interactive, and there's a lot of what we're talking about on the website that can be actually found out. We're open 6 days a week, Monday through Saturday, 6 mornings and 4 nights. And we're here practically every day except Sunday.
Well, that's great. I appreciate not only informing me, but the residents of East Brunswick about the wonderful work you do down here at AIMS. Again, as we always like to say, we like to say shop local here in East Brunswick. In this case, if you're looking for whether it's a new doctor or a new treatment, your old doctor and your old care, maybe you just want to change your lifestyle, certainly come down to the folks here at AIMS at 150 Tice's Lane and let them take care of you in the best way possible. Thanks again very much.
Thank you.
Thank you.